Right now, as you're watching this video, your skin might be screaming a warning that could save your life. But you're not listening. Most people ignore these silent signals until it's too late. What if I told you that diabetes doesn't just appear overnight? What if your body has been sending you desperate messages for months, maybe even years, through your skin and mouth? Today, we're decoding 10 critical warning signs that appear long before any blood test catches diabetes. Miss these, and you could be heading toward blindness, kidney failure, or worse. Here's a terrifying truth. Over 88 million Americans have prediabetes, but 84% don't even know it. While everyone focuses on blood sugar levels, your skin has already become a billboard of warning signs. Research reveals that up to 70% of people with diabetes develop skin complications, often appearing years before diagnosis. These aren't random skin problems. They're your body's emergency broadcast system. The question is, are you listening? Now, let's dive into the list of early diabetes warning signs that may show up on your skin and in your mouth, beginning with number 1. Acanthosis. Nigricans. Dark, velvety patches creeping across your neck, armpits, or groin aren't just cosmetic concerns. They're alarm bells screaming about what's happening inside your body. This condition, Acanthosis nigricans, might be the most important early warning sign you'll ever encounter. The Cherokee Diabetes Study, published in Diabetes Care, examined over 2,200 participants and discovered something shocking. 35% of people with these dark patches had diabetes, compared to only 18% without them. Even more alarming, research published in PMC found these patches in 19.4% of primary care patients across all age groups, making them twice as likely to develop diabetes. These patches appear because your body is drowning in insulin. When cells become resistant to insulin, your pancreas floods your system with more of this hormone, trying desperately to control blood sugar. This excess insulin activates growth factor receptors in your skin, creating those characteristic dark, thickened areas. The patches typically start subtle, a slight darkening around the neck that you might dismiss as poor hygiene, but they gradually thicken into rope-like, velvety textures. They're most commonly found on the neck, armpits, groin, and sometimes hands, elbows, or knees. What makes this sign so powerful is its visibility. You don't need medical tests to spot it. If you notice these changes, especially if they're appearing on multiple body areas, seek medical evaluation immediately. Early intervention could prevent full-blown diabetes. Next, sign number 2, diabetic dermopathy. Small, round, brown spots on your shins that look like age spots but feel different. These mysterious marks called diabetic dermopathy are actually the most common skin sign of diabetes, affecting up to 55% of people with the condition. Research published in the British Journal of Diabetes reveals these spots often signal more serious diabetic complications brewing beneath the surface. People with diabetic dermopathy show higher rates of retinopathy, nephropathy, and neuropathy, the devastating trio of diabetic complications. These spots begin as red or brown, slightly scaly patches that gradually flatten, sometimes leaving small depressions in the skin. While they can appear anywhere, the front of the lower legs is their favorite target. Studies published in Endotext found that having 4 or more of these lesions is almost exclusively seen in people with diabetes. The mechanism involves damage to small blood vessels caused by chronic high blood sugar. Some research suggests these spots develop in response to minor trauma in people whose skin healing is already compromised by diabetes. What's remarkable is their timing. These spots often appear before other diabetes symptoms become obvious, making them valuable early warning signals. The spots themselves are harmless and require no treatment, but their presence should trigger immediate diabetes screening. Unlike true age spots, diabetic dermopathy lesions may fade with improved blood sugar control, though this process can take up to 2 years. Next, sign number 3, Scleredema diabeticorum. Your skin gradually thickening and tightening, especially across your upper back and shoulders, until it feels like leather. This isn't aging. It's Scleredema diabeticorum, and it affects approximately 1/3 of people with diabetes. This condition causes skin to become hard, thick, and waxy, most commonly affecting the upper back, shoulders, neck, and sometimes arms. The thickening happens so gradually that people often mistake it for weight gain or normal aging. The culprit is advanced glycation end products, proteins that become cross-linked and rigid when exposed to chronic high blood sugar. These products accumulate in the skin's deeper layers, making collagen fibers thick and inflexible. Studies show Scleredema diabeticorum is more common in men and typically appears in people with long-standing diabetes. However, it can occasionally be a presenting sign, particularly when blood sugar has been elevated for extended periods without diagnosis. As the condition progresses, skin becomes noticeably thick and movement can become restricted. In severe cases, shoulder and neck mobility becomes limited. While there's no specific cure, research indicates that aggressive blood sugar control may slow progression and sometimes lead to modest improvement. Physical therapy helps maintain joint mobility. Next, sign number 4, Necrobiosis. Lipoidica, yellow-brown patches on your shins that gradually grow larger and develop an almost translucent quality, sometimes revealing blood vessels beneath, represent necrobiosis lipoidica, one of the most distinctive diabetic skin signs. Though rare, affecting only 0.3% of people with diabetes, this condition is unmistakable when it appears. Research published in StatPearls shows strong associations with diabetes, particularly type 1, with women affected 3 times more often than men. The condition begins as small, raised bumps resembling pimples, but evolves into larger flat patches. Centers become yellow or waxy-looking while borders remain reddish-brown. What makes these lesions particularly concerning is their tendency to ulcerate after minor trauma. The mechanism involves damage to small blood vessels and collagen structure changes. Studies suggest immune complexes and microangiopathy play key roles. Remarkably, necrobiosis lipoidica can appear before diabetes diagnosis, making it a potential early warning sign. The patches most commonly appear on the front of lower legs, but can develop on hands, arms, or trunk. While initially painless, they can become itchy or tender. The real danger arises when they ulcerate, happening in about 35% of cases. These ulcers heal poorly and may become infected. Treatment options are limited, but early intervention with corticosteroids may help prevent progression. Next, sign number 5, diabetic blisters. Large painless blisters appearing overnight on your feet or hands without injury. This is bullosis diabeticorum, one of diabetes' most mysterious complications. Affecting only 0.5% of people with diabetes, these blisters are unmistakable when they appear. Research published in StatPearls indicates they typically occur in people with long-standing diabetes and are more common in men. The blisters range from small bubbles to lesions several inches across, with a distinctive burn-like appearance but without pain. They most commonly appear on feet, lower legs, hands, and forearms, containing clear, sterile fluid. Most remarkably, they appear suddenly, often overnight, without obvious triggers. Studies indicate most people who develop diabetic blisters have associated complications, particularly neuropathy or kidney disease. The mechanism involves skin structure changes from chronic high blood sugar and possibly increased susceptibility to unnoticed trauma in people with neuropathy. Unlike other blisters, these heal completely within 2 to 6 weeks without scarring, provided they don't become infected. The key is keeping them intact and protected during natural healing. However, their appearance often signals serious underlying diabetes complications, making them important indicators that diabetes management needs immediate attention. Next, sign number 6, eruptive xanthomatosis. Small, red-yellow bumps suddenly erupting across your arms, legs, and buttocks almost overnight. This dramatic manifestation, called eruptive xanthomatosis, represents one of the most urgent diabetic skin signs. These tender, 1 to 4 millimeter bumps surrounded by red halos directly linked to severely elevated triglyceride levels, usually above 2,000 milligrams per deciliter. Research published in the Cleveland Clinic Journal of Medicine shows this often occurs with poorly controlled diabetes. A case study in the New England Journal of Medicine reported a patient with triglyceride levels of 8,869 milligrams per deciliter who developed these characteristic bumps. This isn't cosmetic. Such triglyceride levels carry significant acute pancreatitis risk, a potentially life-threatening condition. The bumps appear on hands, feet, arms, legs, and buttocks, areas experiencing frequent movement and minor trauma. They're distinctive for appearing in clusters and associating with severe hypertriglyceridemia and poorly controlled diabetes. Studies show eruptive xanthomatosis affects approximately 10% of patients with severe hypertriglyceridemia. It's more common in young adults and can sometimes be the first sign leading to diabetes diagnosis. The mechanism involves lipid-laden cell accumulation in skin due to the body's inability to process fats when blood sugar and triglyceride levels are severely elevated. Research published in PMC demonstrates these lesions contain foamy cells filled with lipids. Fortunately, eruptive xanthomatosis typically resolves with proper treatment. With aggressive blood sugar and triglyceride management, bumps usually disappear within weeks to months. Next, sign number 7, bacterial and fungal skin infections. Skin infections that keep returning despite treatment, or infections that seem more severe than expected, represent one of the most common early diabetes signs affecting millions before diagnosis. High blood sugar creates environments where bacteria and fungi thrive while impairing immune system function. Research from the American Diabetes Association shows skin infections among the most frequent diabetic complications. Bacterial infections often involve Staphylococcus bacteria, manifesting as styes, boils, folliculitis, carbuncles, and cellulitis. These infections tend to be more severe, last longer, and recur more frequently compared to those in people without diabetes. Fungal infections, particularly Candida albicans, create itchy, red areas surrounded by small blisters and scales. They appear in warm, moist areas like underbreasts, around groin, between fingers and toes, mouth corners, and armpits. What makes these infections significant as early diabetes signs is their recurrent or unusually persistent nature. Many people experience repeated athlete's foot, jock itch, or vaginal yeast infections before diabetes diagnosis. Nail infections are also more common, particularly difficult to treat toenail fungal infections that may serve as entry points for more serious bacterial infections. Next, sign number 8, skin tags. Small, soft, hanging skin pieces attached by narrow stalks. These common growths, called skin tags, may be among the most accessible early warning signs of diabetes and insulin resistance. Groundbreaking research published in the Journal of the European Academy of Dermatology and Venereology found people with multiple skin tags had significantly higher insulin resistance levels, even when controlling for other diabetes risk factors. The study showed individuals with skin tags were 7.5 times more likely to have elevated insulin resistance markers. Research published in BMC Research Notes found 85% of bariatric clinic patients had skin tags, and those with tags had significantly higher blood pressure and blood sugar levels. Studies show 52% of people with more than 30 skin tags had diabetes, compared to much lower rates in people with fewer tags. This correlation exists even when controlling for body weight, suggesting skin tags independently associate with metabolic problems. The mechanism involves insulin's effects on skin cells. When insulin levels are chronically elevated due to resistance, the hormone activates growth factor receptors in skin, leading to these small growths. Interestingly, skin tags may regress when insulin resistance is properly treated. Some research suggests that, with significant weight loss and improved insulin sensitivity, existing skin tags may shrink. Next, sign number 9. Dry, itchy skin. Chronic dry, itchy skin, xerosis, represents one of the earliest and most common diabetes manifestations that many experience years before diagnosis. Research published in PMC found xerosis affects up to 81.3% of people with type 2 diabetes. The Italian multicenter study revealed foot xerosis in 90.2% of diabetic patients, with lower limbs affected in 83.6%. When blood sugar levels are elevated, your body eliminates excess glucose through urination, leading to dehydration affecting your skin. High glucose levels cause the body to pull fluid from cells, including skin cells, to produce enough urine for sugar elimination. Research published in Endotext shows diabetes affects skin's oil and sweat glands. Sebaceous glands producing oils for skin lubrication become less active due to impaired insulin signaling. Autonomic neuropathy causes sweat glands to atrophy, further reducing natural skin moisturizing. Studies found direct correlation between blood sugar control and skin dryness. Research shows people with higher HbA1c levels had significantly more severe xerosis. Patients with itchy skin had significantly higher fasting glucose levels. Xerosis in diabetes has distinctive patterns. While affecting any area, it most commonly appears on feet and lower legs, creating scaling, rough textures that can progress to painful cracks and fissures. Next, sign number 10. Dry mouth, gum disease, and other dental issues. Your mouth might be urgently communicating crucial health information through persistent dry mouth, recurring gum disease, frequent dental infections, burning sensations, and delayed healing after dental procedures. Dry mouth, or xerostomia, is among the most common oral diabetes signs. High blood sugar affects saliva production, reducing both quantity and quality. Research shows people with diabetes produce less saliva with altered composition, including higher glucose content that feeds harmful bacteria. Gum disease, particularly periodontitis, has a bidirectional relationship with diabetes extensively documented by researchers. Studies published in the Journal of Periodontology show people with diabetes are 3 times more likely to develop severe gum disease, while gum disease makes blood sugar control more difficult. Signs include gums that bleed easily, persistent bad breath, loose teeth, recurrent oral infections, burning or tingling mouth sensations, and delayed dental healing. Some notice altered taste or frequent slow-healing oral ulcers. Fungal infections, particularly oral thrush, are more common in people with diabetes. High glucose in saliva creates ideal environments for Candida fungus, leading to white mouth patches, burning sensations, and altered taste. Research indicates these oral manifestations can be early warning signs, appearing months or years before diabetes diagnosis. These 10 signs represent your body's remarkable early warning system. From Acanthosis nigricans' dark patches to xerosis' persistent dryness, from diabetic dermopathy's mysterious shin spots to oral warning signs, each manifestation tells part of your metabolic health story. Their power lies in accessibility. You need no expensive test to notice them. They're visible, tangible signals that could prompt life-saving medical evaluation. Research consistently shows early diabetes detection and treatment can prevent or delay serious complications like heart disease, kidney failure, blindness, and amputations. If you've recognized any of these signs, don't wait. Schedule healthcare provider evaluation immediately. Early intervention can make the difference between manageable condition and life-altering complications. Knowledge is power in health. By understanding these early warning signs, you're taking control of your well-being and potentially changing your future health trajectory. If this video was helpful in teaching you about diabetes warning signs, kindly type helpful in the comments. That motivates us to produce more content like this. Like this video if it provided valuable information. Share it with others who might benefit. And subscribe to our channel for more health insights that could make a real difference in your life. Thank you for learning about these important health signals.